Welcome to another episode of the Empowered Fertility Podcast, the place where we dive deep into all things fertility. I'm Dr. Brenna Squires, a clinical psychologist and fertility support coach, here to bring you the knowledge, resources, and expert insights you need to feel confident along your journey to parenthood. So let's get started. Welcome to our next episode of the Empowered Fertility Podcast. We're going to be talking about something that you've probably heard about, but you don't really know much about it, and that is our microbiome. Your microbiome plays a huge role in your mental health and your fertility, and it actually helps regulate your hormones, supports your immune function, and even produces neurotransmitters like serotonin, which affect your mood, stress levels, and reproductive balance. So I'm here with Julia Young to talk more about it. She is a BANT registered nutritional therapist specializing in fertility. She supports couples who are struggling to conceive, helping them take proactive steps towards their dream of having a family. Julia provides personalized nutrition and lifestyle support, focusing on identifying and addressing the root causes of fertility issues. So I just want to say welcome, Julia. Thank you so much for coming on the Empowered Fertility Podcast.
Thank you. And thank you for having me. I'm really excited about this.
Yes. So before we get started about today's topic on the microbiome, I wanted to ask you a quick question about why you decided to specialize in nutritional therapy.
Okay, I suppose I've always had an interest in nutrition and health in general. But I wanted to, the reason I went into kind of fertility is because I had my own fertility journey, and I kind of wanted to help people that were struggling to conceive. And when I was going through it, there just wasn't that support out there. I wasn't aware of nutritionists that could work in the field of fertility. So, having had this sort of long-term interest in nutrition, and actually my past career was working media, so it was completely different. And I had my family, and I decided I wanted to go into the sort of nutrition side. So I then went and studied for 3 years in nutritional therapy. But then when I finished, I wanted to focus on an area, and I initially thought women's health would be of interest, but I wanted to go deeper, and I wanted to really go into the area of fertility. That's why I decided to then specialise in fertility and go on to do further training in that area. And ever since then, I've always worked with women and couples to support them on their fertility journey with nutrition and lifestyle.
That's so wonderful. I like how it starts off with an interest and then just your personal experience and then the desire to go deeper. And you actually followed that desire to go deeper and deeper. And we're going to talk about one of those really deep topics that's not often discussed, which is the microbiome. And can you share a little bit more about what the microbiome is and the different types?
Sure. So it's a fairly new area of research. We hear about it a lot, don't we? Particularly the gut microbiome is talked about a lot, and gut health, and it's so important for your gut, and you've got to support your gut, and health starts in the gut, all these terms that we hear. But really the microbiome or the microbiota are the bacteria that we have in our body, and or the gut bugs, we like to call them, and we have trillions all over the body. So yes, we have the gut microbiome, but we also have a skin microbiome, for example. So all the bacteria that's on our skin that we can't see, but they're all there. There's an oral microbiome. There's an eye microbiome. So there's many, many different types. Which can, the vaginal and the semen microbiome can very much influence our reproductive health. So the main types would be the gut, the vaginal, the semen, urine microbiome, particular interest, particularly people that are struggling with urine tract infections, chronic infections, and they might want to be looking at that area. The uterine microbiome is a fairly new area, and again, particularly important if you're looking to conceive. So those are probably the key ones that we want to look into.
Yeah, and so you just shared so many different types of microbiome. And basically, like you said, it's about the bacteria in those certain areas of your body. And I only ever heard of gut microbiome because that is such a big topic, but there's so many different types. And I'm wondering, how do they interact with one another, and do they interact with one another? What does that look like?
Yeah, they really do. There is definitely a systemic interaction, mainly through immune and hormonal pathways. For example, your gut microbiome, if it's not imbalanced, it can contribute to inflammation and immune dysregulation. We know that the gut microbiome is important for regulating hormones, as I said, immune function, nutrient absorption, even makes some vitamins for us. So it's really, really important that we have a really robust gut and a good gut microbiome. And then interaction, of course, between the vaginal microbiome and the semen microbiome. If a couple are having intercourse and those two microbiomes are going to interact with each other, and bacteria can pass back and forth. So that's something we have to be really aware of as well. And definitely an interaction between the vaginal microbiome and the uterine microbiome. So we see the vagina as kind of like a gateway to the inside of the body in a way. It's kind of a gatekeeper, and it will keep it's from the bacteria from the outside coming in. But we know from the research that quite often what's going on in the vaginal microbiome, it can be similar to what's going on in the uterine microbiome. So you might want to look into the vaginal microbiome and get an idea of what's going on further upstream, basically. So all of these microbiomes are talking to each other and interacting with each other all the time, which I think is really cool, actually.
Yeah, that's so interesting because then it makes you think that when it comes to overall health, there's many different things that can go wrong with our microbiome. But then when you also think about it when it comes to fertility, there's many different things that could be an underlying risk factor for infertility. And many of these things could be overlooked.
Yeah, absolutely. And it's not one that a lot of people will think about checking or testing. And it's particularly important if, we never sort of do any of these tests to make a diagnosis, but if you have been told that you've got unexplained infertility, and that's that kind of, I don't see that as a diagnosis. That's that annoying thing that you're told your doctors or your consultants have done various tests. Everything looks normal. They can't see anything that could be causing the infertility, and so you're told it's unexplained. But actually, for example, looking at the vaginal microbiome or the semen microbiome could give us some insight into a root cause there that we're completely unaware of. And
Yeah.
we may have symptoms, but we may not have any. And that could actually be one of the root causes of why a pregnancy or conception isn't happening, or why you're not having a successful pregnancy, for example.
Could any of these imbalances in these different areas, these different microbiomes, could they give us clues into different hormone imbalances or different diagnoses? For example, PCOS or endometriosis, would it show something in your microbiome?
So there, yeah, I mean, if you're doing testing, for example, there's certain patterns that we might see. For example, if you did a vaginal microbiome test and there was very, very low lactobacillus, the beneficial bacteria, that can often be common with women with endometriosis, for example. Or if, for example, we're testing and we're testing the pH, the acidity of the vagina, and we're testing the inflammation, that's really high. That could be again associated with endometriosis, which we know is an inflammatory condition, or PCOS, which is also often an inflammatory condition. So they can certainly give us some clues as to what's going on by doing this testing. Definitely.
Yeah, so a bunch of different clues. So let's break down some of those clues and look at some different areas. So let's start with ovulation. Can the microbiome, either vaginal or urinary or any of the other areas, could that impact ovulation?
It could, again. I mean, we know it can definitely influence hormone balance, and ovulation could be a key one. Again, we can't use it as a diagnostic tool to say this is why you're not ovulating. But there could be bacteria that the main ones we tend to see with the testing is, we know, for example, a certain bacteria can be linked with preterm birth. So we don't want to be going into a pregnancy, for example, with a dysbiotic microbiome that may mean that we have a preterm birth. Or there's evidence to show that there's bacteria which is linked with miscarriage risk, for example. So again, you don't want to be, if you're finding this out before you've conceived, that you're carrying bacteria that could increase the risk of miscarriage, obviously you'd want to get that sorted out beforehand, and various other bacteria. For example, your ureaplasmas or your mycoplasmas, which are associated with generally with fertility challenges and maybe making it difficult to conceive. So it's more to do with maybe affecting the pregnancy or actually the conception process, I would have thought, with what we're seeing so far in the research on the microbiome.
Okay. Okay. So, not exactly a direct link with ovulation, but it seems like there's more of a connection related to pregnancy and once you get a little bit further along. So, I'm
Yeah,
curious, what about men's health? Sperm quality, sperm motility, anything like that? Does it
yeah.
impact them at all?
It can do, definitely. So what I tend to do is, the first port of call is I'd ask a man to do a semen analysis, and we'd look at that.
Mhm.
And if that's not looking optimal, we might think maybe we need to see what are the root causes of why this is the semen quality not good. Could it be down to an infection in the semen? If the pH of the semen is slightly raised, that's also another clue that maybe there's an infection there. And we know, yes, that there's certainly lots of bacteria in the seminal microbiome, which can be linked with things like varicocele, which are a bit like varicose veins on the testicles. Sometimes you can see them just through a physical examination. Sometimes you need to do a testicular scan, but basically they produce heat and they can damage sperm. So you can see some bacteria that are linked to conditions like that. Also, some of the bacteria can be linked to poor DNA quality as well. And we know that the DNA is what makes up the baby, 50% of the baby. So again, we want the DNA quality to be really good here. So again, and other parameters like motility, morphology, they can also be impacted by bacteria. So
Yeah.
actually, just doing that test and then supporting what the results are to improve the microbiome can be a really simple thing to then get better DNA quality in the semen and better overall semen quality from doing a semen analysis test as well. So it's a really good one to do.
Would you say that if the semen quality is not great and you find that there is some bacteria there and their microbiome is not very good, what happens when the egg and sperm connect or the seminal fluid connects with the vaginal fluid? Would there be any concern there?
Yeah, I mean, again, because it could potentially be impacting, for example, the morphology, so the shape of the sperm, what the sperm
Yeah.
is looking at, have they got a tail, have they got a head, etc. We know we want the best quality sperm we can get for that best quality embryo we can get. So if the
Yeah.
sperm quality is poor, it is going to reduce your chances of a successful pregnancy, or maybe pregnancy occurs, but then early miscarriage could be something that happens. We know that miscarriages occur up to around 12 weeks, maybe slightly longer, can be linked to the male side as well as the female side. So we can never, quite often the emphasis is put on the woman, but we shouldn't be ruling out the man when there's an early miscarriage there, because it could be down to semen quality, which could be impacted by an infection. So yes, it can
Yeah.
definitely. And if you're going through fertility treatment, for example, so IVF or something like that, again, it can affect the success rate of the IVF if the semen quality is poor. And even and we know, again, with something like IVF, there's so many different treatments and add-ons that they can offer these days, but they don't really impact the quality of the sperm, and that's what's important. We need to have really good quality sperm to have a successful pregnancy, making sure that the pre-conception work is done, and when we start, we've got good quality sperm and eggs. That's going to be the most important thing here.
Yeah, so the biggest thing is good
Yeah,
quality eggs, good quality sperm, good quality bacteria. And
yeah.
so, with that, before we even move on into testing, are there any clues or symptoms that a man or woman might see within themselves to let them know that the microbiome might be off?
Yeah. So if we start with looking at the gut, for example, there's some obvious things. So, bloating, constipation, diarrhea, having maybe some food intolerances, frequent gut infections, even things like headaches, stuff like that, all could be linked to the gut. But also you could have a gut that you think is functioning really well, and there could still be pathogenic bacteria there. So it's not always a given, but certainly if you've got some really obvious IBS, obvious gut symptoms, then that's a sign that that your gut might not be functioning as well as it could be, and a sign that you don't have as good of the beneficial bacteria or a higher level of pathogenic bacteria. It's what we call dysbiosis, when there's an unbalanced microbiome. So that's, with the gut, again, there can be quite obvious symptoms. With the vagina, so you're thinking of things like maybe you've had thrush in the past, or candida, or bacterial vaginosis, so you've got a history of conditions, then again we might want to look into things, or maybe a history of urinary tract infections, or you may notice that yes, you get the monthly ovulation, the kind of egg white type mucus discharge, but you also notice other discharge which maybe doesn't seem quite right. Maybe you notice a thickish, whitish, cottage cheese-like discharge. That's often a sign that something's not quite right. Or maybe it's slightly grey or green in colour. Or you might notice a sort of fishy odour at times as well. That's a sign something's not quite right. Or maybe you notice pain on intercourse, so discomfort or pain on intercourse. Again, a sign that something might not be quite right with the microbiome. With the semen microbiome, it tends to be more asymptomatic, so there tends to be less clues that something's going on. So, as I said, looking at the semen analysis, and is that pH raised, or if your female partner has been tested and there's been pathogenic bacteria and you've been having intercourse, it's likely that it's been passed on to you as well. These microbes get passed back and forth through intercourse. So that's a clue that we should look into things. And any past sexually transmitted infections as well, again, is a clue that we should be looking into the microbiomes, and maybe something's not quite right. But having said that, especially with the vaginal microbiome, a lot of the women I test, they're completely asymptomatic. They've got no idea, and they're quite surprised that then we test and quite a lot actually comes up. So that just because you don't have the symptoms shouldn't be a reason that you don't look into that area, for sure.
That's wonderful. Thank you for sharing all of that, because sometimes we see these symptoms and we dismiss them as normal. We say that's just normal, a normal part of being a woman, or just a normal part of being a man. And this is not a big deal. But in reality, it is a big deal, especially if you have something called unexplained infertility and you have all of these little clues that you're not really thinking about as clues. But if you start thinking about them now and look at them as tiny little clues that can possibly add up, it can give you an idea of something that is going on under the surface that you might not really know about. And
Yeah.
I like how you also mentioned that, of course, there are some times where we are asymptomatic, so we don't have any symptoms. And so that's why we have these additional tests. Can you share a little bit more about the different types of tests and what they look for?
Sure. So the vaginal microbiome test, normally it's a very easy test you can do at home. So a kit sent to you at home, and you do a vaginal swab, and it's sent back. And the test that I like to use now is one that uses something called NGS, and next generation sequencing. That's the DNA sequencing. It's the kind of type of testing they do, and it looks at 100% of the microbiome, which is really important, because if you go to your doctor, maybe you've got some symptoms and they do a test, they do what's called a culture, and they look for certain microbes. And if those 4 or 5 microbes aren't fine, you're sent away and said, there's no infections, everything's fine. Whereas if you look at the 100% of the microbiome, it's going to pick up everything, good and bad. And I think that's really, really important. So the vaginal microbiome will look at your percentage of lactobacillus, which I said is the good bacteria. And we want to be seeing around 99% lactobacillus. We want the majority to be that good bacteria. And then it will look at pathogens, and it will look at yeast overgrowth and mold as well. So we look at all those areas. And again, with the semen microbiome, again, it's fairly new testing, but again, it looks at 100% of the microbiome. So it's slightly different with the vaginal microbiome. We don't want it to be very diverse. We don't want there to be loads of bacteria there. With the semen microbiome, it can be more diverse, and that's actually better. And same the gut microbiome, which you test via a stool test. Again, you can do it at home. We're looking for a really diverse environment. So a bit like a kind of rainforest, we want there to be the monkeys and things like that, but also the snakes and we're supposed to see lots of different species. So diversity with the gut, also the semen, but with the vaginal microbiome, it's less diversity there. It's important.
That's awesome. And then you said these are all tests that you can do at home.
Yeah. So really simple. A kit is sent to you. You do the swab, it's sent off to the lab, and then the results come back. Quite complicated results. So always, best to order them through a practitioner and get those results analysed for you and fed back to you. But it's for the patient, for the client, it's really easy to do at home. That you don't have to go anywhere, which is really handy.
Yeah, and nowadays I really like the ability to be able to do at-home testing because it makes it not only does it make it easier, but it also increases the likelihood you're going to do it because then you
Absolutely.
don't have to take all this time off of work. You don't have to do anything that seems too stressful to the body or too stressful to just add on to your plate. You just order it, have it sent to your house, and then you do it. So I really like the idea to have that at home testing. But like you said, along with at home testing often comes complex test results. And so that's why it's important to meet with a practitioner, someone who knows how to read those test results so that you can interpret them properly.
Yeah, absolutely.
And I also like how you shared that what you're specifically looking for, because that's one of the bigger questions too, is so now I'm going to do these tests and what are they going to show or what am I looking for? And I like how you described the gut. You really want um, a diverse amount of bacteria, good, so that, it builds up the good bacteria in your body, but you want a diverse amount. And then the same thing with the seminal.
Yeah.
But with vaginal, you want something very specific. You want something that is much higher. You want bacteria that is higher in one than the other. Do you mind sharing a little bit more about why vaginal microbiome is different than gut and seminal?
Good question. I'm not entirely sure why we want it. With the semen, I mean, as I said, we are looking for more species, but we still don't want the pathogenic bacteria. And same with the gut, really. We don't want pathogens. We don't really. There's some parasites actually that we can live with, and nowadays new research is showing that certain parasites, if they're not causing us any problems, they sounds a bit scary, but we can live in harmony with them.
Yeah.
And there's some bacteria which we call the commensal bacteria, which is the bacteria, as long as it's not too high a level, we can live with it. And with the semen microbiome, less known why it's okay to be diverse, but we still don't want that pathogenic bacteria. So we don't want to find any bacterial vaginosis type bacteria, for example, which is common, which again can be passed back and forth to male and female. We don't want to find any bacteria that could be impacting semen quality. And with the vaginal microbiome, we know that we just want to see a really high level of the lactobacillus bacteria. On the semen side, the tests that I've done, I don't tend to pick up much lactobacillus bacteria, even though we know the lactobacillus is helpful. But on the female side, we know from the research it's really important that there's a very high level. And there's been research that has been done by a miscarriage charity in the UK, which was looking at the cause of miscarriage among a cohort of women. And in those where it wasn't down to genetic reasons, they found that all the women that they tested, they had very low levels of the lactobacillus bacteria, which I thought was really
Wow.
interesting. So we know it's a
Yeah.
protective bacteria. And even if you've got some not so nice ones there, if you've got 95, 99% lactobacillus, you're on we just need to support it a little bit more, but everything is generally looking pretty good, which is really positive.
Wow, that's so interesting to hear that it was shown to have a potential link to miscarriages, because I know one of the big things that's coming out now is with chromosomal abnormalities. And people are often wondering, is there anything else? Because if we do the testing, the DNA testing, and it shows no issues, now what could be a potential? And so you're saying that there's some research out there that talks about lactobacillus, and if there's not enough, that could also be a link
Yeah.
to early miscarriage.
Yeah, it could be a link. And we know genetic is a main risk factor,
Yeah.
but this is
Yeah.
also another risk factor that we should be looking at, definitely.
And so with that, if we do the testing, if someone does the testing and they show this imbalance, how long does it really take to actually rebalance these different microbiomes?
So, good question. I mean, the answer is it depends, and it depends on the severity of what we're finding.
Of course.
Ideally, people don't want to hear this, but ideally around 3 to 6 months. There's different approaches you can take, and sometimes, I mean, I'm not a doctor, so I can't prescribe antibiotics, but sometimes if you've got IVF that's up and coming and you can't delay it, it may be you need to go down the antibiotic route, and that means things can happen quicker. But it may be we still need some time to build up that lactobacillus bacteria. But if you've got, if you're trying naturally and you've got a bit more time, ideally I'd be saying, can we give it 3 to 6 months to really build that back up, maybe even retest to check that things are looking better, and then have the green light to be trying again. But it depends on how much time the couple has and what the test results are showing. But it's definitely not,
Yeah.
generally not a quick fix, unfortunately. It does take a long time with everything.
Yeah, so it sounds like it depends on how much of an imbalance it is. First of all, it also depends on how much time you have and you're willing to put into it.
Yeah.
The 3 to 6 months, I feel like it's for everything. If you're trying to restore something, it takes 3 to 6 months because that's how long it takes to rejuvenate the sperm and egg quality.
Yeah.
But you also mentioned something with antibiotics, how that can speed up the process a little bit. Can you share a little bit more about that? I know it's
Yes.
not ideal, but if it's an option that people might
Yeah.
want to look at.
So generally, so again, we need to assess the client and think, right, for example, if they're going for IVF, and that's obviously a big financial and emotional investment, and maybe we've got less time, and we need to look at what the bacteria they picked up. So I mentioned before these mycoplasmas, urea plasma, which are really associated very much with fertility challenges. You don't want to be going into a pregnancy or fertility treatment carrying those. Even if they're at low level, there's something called biofilms that the bacteria form. So they form these protected biofilms. So sometimes it may appear on the test it's a low level, but that's because the kind of biofilms are almost hiding some of the bacteria there. So when it's ureaplasma and mycoplasma, more often than not, we may say that antibiotics are then the best treatment. As I said, that's not something I can prescribe, but I work with other medical practitioners that can. And then my job as a nutritionist is to help, repopulate the microbiome. The gut will be most likely affected. The vaginal microbiome will be affected, or seminal. So we're working on really supporting immunity and repopulating the gut if antibiotics is the route
Yeah.
they need to go down.
Awesome. Thank you for sharing that. Because it sounds like antibiotics is an option, but it's not the best option for everybody. It seems like it could be an option if you're needing something that is better than nothing. So if you're already going through some type of procedure like IVF or IUI and you want to maximize the potential or increase the likelihood of success, you would want to be able to kill off any bad bacteria and repopulate good. And that's when you would do some type of antibiotic. Does that
Yeah.
sound about right?
Yeah, and if we are going down a more natural approach, if people don't want to do the antibiotics, what we do have access is antimicrobial supplements. So things like
Yeah.
garlic as a supplement can be really
Okay.
effective. Again, it takes longer. It's not going to just happen overnight, but we can use things like garlic supplements to help target the bacteria. And the benefit of that is the antimicrobials don't tend to wipe out everything. So you
Okay.
may find that the gut is less impacted by taking an antimicrobial, for example.
Okay. So again, now we look at antibiotics. That's good for speeding it up, but it does kill some bacteria. Sometimes it kills good bacteria, and we really might not want to do that route. So then we have other options. Can you talk a little bit more about best case scenario? What are the ideal things to do that you would recommend and that you would work on with your clients?
Sure. So I mean, always food first is a really important approach. So we know, for example, that processed foods, sugar, they can disrupt the microbiome. So we'd be talking about reducing those in the body. And as you're eating them, and then making sure we're having plenty of prebiotic and probiotic foods. So the prebiotic foods are the foods that feed the beneficial bacteria. So things like garlic, leek, sweet potato, slightly green bananas, they're our prebiotics, the food for the bacteria. And then the probiotic foods are the foods containing the live bacteria. So things like your yogurt, kefir, kimchi, sauerkraut, miso, things like that. So if we can make sure, every day we're having a source of those, that can be really helpful for supporting the gut and the vaginal microbiome and the seminal microbiome as well. And then supplements, of course, as I said, so maybe antimicrobial supplements, probiotic supplements, so containing the right strains of lactobacillus can be really helpful as well. Sometimes there would be ones that are designed to be actually used like vaginal suppositories, and sometimes they're oral supplements that have been researched that actually reach the vaginal tract, so they can be really helpful as well, taking those. And then looking at lifestyle practices is really, really important as well. So first question I kind of ask my female clients would be, how are you washing your vagina, basically? What are you using? And a lot of times people are using soaps, shower gels, or even products that are supposed to be pH balance, that's supposed to be good for cleaning the vagina. But actually the vagina is self-cleaning, so we don't need to use anything other than water to clean it, and we shouldn't really, because if we're introducing other products, that can again disturb the environment there. So just using water for cleaning. If we've detected there's bacteria there, I'm encouraging the couples, until we've addressed the bacteria, they use a barrier method for intercourse, because you don't want to be supporting one partner and then they're passing the bacteria back and forth. So it's really important that they abstain from intercourse or use a barrier method during that time. Other practices, things like smoking. I mean, we're not recommending smoking for fertility anyway, but actually the research shows that smoking secretes nicotine into the vagina. So even smoking can have almost a direct impact on the vaginal microbiome. Avoiding wearing, if you're working out and you wear lycra, just avoiding sitting around all day in sort of sweaty lycra, because again, you're providing a warm environment for the bacteria. Yeah. Thinking about your sanitary products that you're using. So are they organic? Are they unscented? Are you changing them regularly? Particularly if you have a light flow, you might be not that used to changing them regularly. But again, we don't want anything to encourage the buildup of bacteria there. And if you're using any lubricants, making sure they're unscented, natural lubricants. And then also thinking about your underwear. Is it cotton underwear that you change, you've changed fairly recently, as in you've bought new underwear and it's not something you've had for 10 years in the cupboard kind of thing. Avoiding things like G-strings or thongs, because again, the bacteria can translocate from the anus to the vagina and things like that. So there's lots of lifestyle practices that we need to think about just to maintain that good environment as well. Even if you've done the test and everything's perfect, work on the lifestyle things anyway. Really, really key.
Yeah, those are great. And those are all things that people can do right now. They can start changing those little things in their life today before they even get this testing done. And so I really thank you for sharing all of those amazing tips and solutions that people can do right now that will help them improve their microbiome and improve their overall fertility, and things that they can do right now. So I appreciate all of that.
Yeah, it's simple things. It's just being aware of them, isn't it? Knowing what you need to do, really.
Yes, awesome. And then with that, just wanted to see, we're coming to a close, and I just want to thank you for sharing your wisdom and your advice. But as we come to a close right now, I wanted to see if there was any final thoughts or takeaways you have for our listeners.
Sure. So in terms of, everyday habits that can really support the microbiome. So with, the gut, we want, as I said, we want loads of diversity. So eating lots of fiber, vegetables, aiming to eat around 30 different plants a week.
Wow.
Is really good. Diverse. Sounds like a lot, but in that we would count different herbs as a plant. So if you're eating, I don't know, some thyme with your dinner, and then you're having oregano or something, they would count as 2 plants. So you can include it's plants, so it is actually, when you write it all down, it's doable, basically. Including those fermented foods every day in your diet that I talked about. Prioritizing sleep and stress. Again, stress can impact the microbiome, so making sure we're getting that in. Minimizing our exposure to endocrine disrupting chemicals that can, again, impact the microbiome. So things like plastics, pesticides, synthetic chemicals, that sort of thing. And, antibiotics if they're needed, but if they're not needed, we don't want unnecessary antibiotics, because we know that does negatively impact the microbiome. So only as and when needed. And, getting out there, connecting with nature, all that sort of thing helps us have a diverse and good microbiome as well. So lots of things that people can do.
Yeah, I really like that. And I know I was a little surprised with the number of different vegetables, but I like the recommendation that you said, which we often forget about, which is if you write it down, if you
Yeah.
write down the food that you're going to have throughout the week, you'll notice if you're eating only sweet potatoes or only broccoli, or you're only eating 1 to 2 to 3 different types of vegetables and maybe just salt and pepper. If you're not having a diverse amount of vegetables and fruits, you're really I feel like you're stunting your microbiome and you're not really feeding it what it needs.
Yeah, because they all have each different. I mean, even if you look at like peppers, for example, a red pepper, a green pepper, an orange pepper, they all have different, what we call phytochemicals, so plant chemicals, which have a different impact on our gut bacteria. So even if you don't like a whole range of vegetables, but you like peppers, and rather than going every time for a red pepper, can you just go for different colors? That's a good place to start.
Oh, I love that example. Just changing the color up from an item that you already like.
Absolutely,
Or
yeah,
blending them all together into one meal.
yeah, yeah.
Awesome. Well, thank you so much for sharing, and I thank you for joining me in this conversation. And you had mentioned that you have a freebie for our listeners. You want to go ahead and share that?
Sure. So although I cover all areas of fertility, I have a special interest in supporting women and couples with PCOS, so women with PCOS. So I have a free guide ebook called From PCOS to Pregnancy, root cause strategies to help support your fertility naturally. So there's lots of tips there for women who either have PCOS or think they may have it, in terms of things they want to be adding into their diet, what they maybe want to be reducing, how to go about getting a diagnosis, all those sort of things. So I have that available. I don't know if you can provide the link to listeners.
Yes.
And that's also on my website. And also, if people want to have a chat with me about working with me, I provide a free 30-minute fertility review where you can talk to me about your fertility journey so far, and I can explain how I work, and we can see if we're the right fit for each other. And you can access that on my website, which is juliayoungnutrition.com, or I'm on Instagram at juliayoungnutrition.
Wonderful. Thank you so much for sharing. And yes, we will have all of those links in the description. And for our exclusive members of the Empowered Fertility community, we're also going to take this a little step further and have a bonus session with Julia to talk a little bit more about PCOS and fertility. And so for those exclusive members, you'll have a link to be able to sign up for that to get that bonus session. But for today, this is all. So I just thank you so much for listening to this podcast. And thank you so much, Julia, for being on this podcast. I really enjoyed speaking with you and learning a little bit more about microbiome.
Thank you very much for having me. It's been my pleasure.
And thank you guys again for listening. Have a wonderful day. Thank you for joining us today on the Empowered Fertility Podcast. For access to the bonus content, as well as exclusive resources to improve your health and fertility, head over to the Community Resources Center. You can scan the QR code or click the link in the description. Remember, your story is not over yet. There's always another path forward, and we're here to explore it together. See you next time.